Yes, definitely. No. But what I have understood that a lot of samples are required to be sent outside the state of Nagaland because the facilities are not available for testing of tissues and testing of bloods, etc. So with these equipments that are being installed under this histopathology lab, the requirement of those tissues or samples to be sent outside the state of Nagaland will drastically come down, and which will be a huge benefit for the patients as well as for the doctors also, because they will be able to do their testing here only. Basically, the project has been implemented by the government of Nagaland, and we have done all the communications with the government of Nagaland, and government of Nagaland through their own process have installed these investments. We have given the required fund to the government of Nagaland. It's a one-time fund. It's a one-time fund for purchase and installation of this.
So have you arranged any workshop of this? Some of them are here. President for Doctors for You. Good evening and welcome to this inauguration of the Histopathology Lab, which is being sponsored under the under the CSR project, and this is a histopathology unit, and the inauguration of this would be the first in Nagaland. So our heartfelt gratitudes go out to the CSR sponsors, NRL and Numaligarh Refinery Limited.
Health, mercy to the needy is a loan to God, and God pays back those loans in full.
And so, if this is the only facility in Nagaland, let me just say I'm very honored. My first visit to Nagaland, the first official act is that connectivity is still an issue.
Yes.
So these samples, while it's much better than sending them to Kolkata, is there any urgency in getting the samples to a histopathology lab?
Yes. So the earlier the patient gets the report, so they can start the treatment earlier, so that it prevents the disease from progressing further before they get the treatment, which is happening in many of the cases now. So for specialized tests like immunohistochemistry, which we will be starting shortly with the new machines which we have. So right now we are outsourcing to other states, other parts of India. So it takes time.
Okay. And what are the most prevalent cancers?
The most common cancer which we see in the north, especially in this area, is nasopharyngeal cancers. So we have a genetic predisposition to the cancer also. And it's a combination of both the genes as well as some infection, some viral infection, which is also said to be implicated in that.
Recruit specialists?
So we already have the technicians. Of course, they will need some further training. It's quite a specialized and quite technically challenging. But thankfully, from the machines which they have donated us, most of them are automated. So even the staining procedures, everything is automated.
And all the reagents are easily available?
Yeah, we usually source it from outside the state. So we can get it.
It's a unique model that has been created, because most of the hospitals, they just have a cytology systems or just the automatic like blood test. So the histopathology has been set up, like the processing is being done, and now we have tied it up that the trainings, if needed, tied up with the Tata Cancer Hospital has been done, so that if the upliftment of the staff is needed, so a training setup has already been established, so they can be trained and then retrained on a regular basis, so that the diagnosis is done there and then, and the treatment is not delayed, because every delay in cancer treatment increases the stage of the cancer, which added to the bad prognosis of the patient as well as increases the cost of the treatments.
Well, I must say it's a great honor. This is the first plaque on which I have my name. I thank you for that.
Sir, he's psychiatrist. He's the NRL. He's the one who sponsored.
And is this a part of IOL? So OIL, is it the refinery?
NR Oil is our majority shareholder, sir.
Right.
So they are our parent company.
Uh-huh.
All India.
But given the history of oil exploration in Digboy, etc., so this refinery is one of the oldest in India, is it? Or
Digboy is the oldest, sir. In Assam there are 4 refineries. After Digboy, the second refinery was in Guwahati. It is run by IOC. Third is in Bongaigaon. It's in Golpur district. It's also run by IOC. Ours is the 4th refinery. It came out as a byproduct of the Assam refineries.
What is your name?
Here, Borua.
Today is a historic moment, not only for the hospital, but also for the state of Nagaland, because there have been many equipments, the need of the hour, because of the rise in cancer within the state and the need for early diagnosis and treatment. Under the bannership of our Prime Minister and under the CSR project, this is the first histology unit that has been installed under the CSR program, which has been sponsored by the Numaligarh Refinery Limited.
Today is a momentous day for Nagaland as well as NHAK, because we are inaugurating first of its kind histopathology lab in Kohima, and we are grateful for all who are present here and who have contributed. Before I proceed further, let me invite each of the delegates today to this function. Wanted a CSR and investment conclave to happen in Nagaland. In this regard, there was immense support provided by Government of India. Finance Minister Madam Nirmala herself was part of the initial inauguration of this event, and Ministry of Corporate Affairs helped us a lot to connect with many of the PSUs and companies in India. To give a very small brief, at that point of time we were getting only very small amounts as CSR. So out of 24,000 crore that is flowing in the country as CSR every year, hardly 1 or 2 crore were coming to Nagaland. So there was a coordinated effort that was made to ensure that CSR is coming in a structured manner, towards which we prepared a database of possible CSR projects all across the state with support of district administration, NGOs, departments. So from that we were able to create a state priority list of projects that we circulated to PSUs. And in the state priority list of projects, there were 24 projects from health department, and we were able to send this list against various companies which expressed their interest. The parallel action was done to ensure that our capacity in Nagaland is built on concept note, DPR preparation, implementation, and monitoring and evaluation. So, as part of the inauguration of the CSR conclave itself, a monitoring and evaluation system with GIS tagging was inaugurated. And parallelly, competent people were brought in for monitoring and evaluation. A monitoring evaluation cell was set up so that the companies know that things are happening on the ground. Northeast technically was a black box for many of the companies because they were not sure whether they will be able to come and do the projects in Nagaland or whether there are deliverable, credible partners or deliverables will be happening. So we assured this solution through Investment and Development Authority of Nagaland, which acted as the nodal entity for CSR mobilization. We assured that we will connect you with the right set of implementers, right set of project that is at the ground level, and we will ensure 3 years of monitoring and evaluation support. This sorted out many of the problems that companies were having, and we were able to provide them the utilization within the February end of that financial year, which was one of the major challenge the companies were facing because otherwise they would be fined. Another improvement that we brought in the whole ecosystem was that we brought in partners like Doctors for You, who assured implementation at a cost lower than the usual tendering rates. So we were able to brought down the implementation cost by 20 to 30%, where Doctors for You also pitched in with their manpower, expertise, and then reduced the cost drastically. So with the same amount of money that a company is providing, we were able to do the double the work, because the same amount of money would have put in many metros, would have delivered 1/3 of this project. But their support helped us to go beyond the boundaries, and we signed a umbrella MOU to ensure that manpower, capacity building, training and all are coming free of cost as part of the implementation. So it is not just doing a project on the ground or giving the material or construction done on the ground. Instead, it is the complete process of following up and giving the deliverables to the common man.
I don't have much to say. First of all, when this CSR conclave was organized by the government of Nagaland under the with help and patronage from the government of India, I also attended that conclave along with my managing director, Mr. Bhaskar Fukan. And since that point of time, we have been in continuous touch with Mr. Alfred for this project, for the association of NRL in this development initiative for the state of Nagaland. And the professional way in which the entire thing began, it had given us a lot of confidence that something good is going to happen. Because as a corporate house, we have been donating or we have been participating, we have been partnering in number of CSR initiatives across the country. And in all the projects, we don't get that kind of positive response. But by involving ourselves as a partner in this project, from the very first moment, we were very confident that something good is going to happen. And today, by being here again as a witness to this inauguration program, by physically seeing the equipments and the facilities being installed in Dimapur medical establishment, it once again has given us the confidence that in the future years to come, there will be many such projects which will be partnered by not only NRL, but all the corporate houses of India, and Nagaland will be having many beneficial development projects for the benefit of the people of Nagaland. With these few words, I also am very happy and privileged to be in the august company of Sri Bery sir, you sir, and I'm sure sometimes you will take the trouble of visiting our refinery at Numaligarh also. Will be blessed by your kind visit to Numaligarh. I extend my heartiest invitation to you in this occasion itself for a visit to Numaligarh also. And all the friends in Nagaland, whenever you go to Guwahati via Dimapur, then please drop in Numaligarh Refinery as our guest. It will be very great pleasure and honor to host you in Numaligarh.
But I am extremely happy that I can again connect now to Numaligarh Refinery. I am sure it is doing extremely well. And thank you, sir, for making time to come and visit our land. We hope you will come again and participate with us in many more path-breaking initiatives. And I must express my extreme gratitude and appreciation to Development Authority of Nagaland. I have worked with Mr. Reni briefly in finance, and I know that he leads a very efficient team of people who make things happen. And that is the great difference. There are so many people who occupy positions of power and authority, and then there are those people who make things happen. And as you have heard him say, we were, their team from IDAN, were able to give the required amount of confidence to the corporate houses and assure them that things will happen, and they are actually happening now. And I'm extremely grateful to the Union Finance Minister. She came not just to chair CSR conference. She came with the authority and mandate and made sure that the corporate houses came along with her to extend support to her concern and interest to this state. Now this world-class facility is going to benefit tens of thousands of patients. It is, and to think of it, that we are getting this free of cost. Till recently, 4 or 5 years ago, getting medical treatment for the people of our state was actually a life-changing process. Life-changing, not in a positive way. People lost their entire wealth. People experienced unthinkable hardships. They struggled to pay their bills. They had to sell off everything to get treated. They traveled to places that they didn't understand, they could not communicate. Even in 1999, 2000 itself, when I was Deputy Commissioner of Customs Guwahati, I had to drop in sometimes to hospitals to visit patients from my state who were in deep stress and having problems they could not handle. So with this kind of initiatives, our healthcare system is getting transformed. And the Chief Minister's health insurance scheme is giving them finally that dream cashless treatment facility. And now they have the confidence of traveling from the remotest parts of the state to the best hospitals in the state. From the border areas near Myanmar, people now have the confidence of coming here. And just imagine they will now come and get the best facilities that modern technology can provide. I thank you, Numaligarh, and I hope that Numaligarh Refinery will do more such life-transforming CSR projects in the state in the years to come. Thank you.
In Northeast over a period of 15 years, and the engagement model is that the NGO will be bringing funds through CSR, will convert it into a model nursing college for Northeast over a period of 15 years. After that, it will be handed over back to the state government. So this is the significance of this engagement.
Me too, a special day because it's firstly, I think it's the first time I have my name on a plaque, and secondly because it is my first visit to Nagaland, which I've known in many contexts, including one that I hope will be fulfilled tomorrow as an epochal site of the Battle of Kohima, which I think the world has perhaps somewhat forgotten, but really was pivotal in so much that followed. But more importantly, I mean, it is my duty as Vice Chairman Niti Aayog, and I report to the Prime Minister, who, as you know, is the Chairman of Niti Aayog, to visit each member of Niti Aayog's governing council in their home state, and I hope to do that tomorrow in Dimapur. So the governance model of Niti Aayog is that we have a governing council on which chief ministers of all states and lieutenant governors of union territories, when they don't have chief ministers, come together in a carefully prepared meeting to debate the way forward for India. I was appointed to this position in May of 2022, and so I've participated now in 2 meetings of the Governing Council, and I would just say that it is a thrilling experience because our press, and they're paid to do that, always focus on the politics of chief ministers, and chief ministers rightly have to devote a large part of their time to the business of gaining power, staying in power, and managing a state. But what I see in the governing council is the other side of chief ministers, which is chief ministers as very shrewd development practitioners. And Prime Minister Modi refers to that gathering of chief ministers as Team India, which is to say that people put aside their political differences and essentially dedicate themselves to the welfare of citizens in their states, but collectively to the noble cause of raising India to its rightful place in the world. Now we are just on the edge of an election season. You would have been listening to a lot of the achievements of this government in the 10 years that it's been in office, but I think one of the most striking examples of the progress that India has made has been its steady rise amongst, in terms of the size of the economy, to a point where it is now the 5th largest economy in the world. And that is a sign that compared to what's been happening in the rest of the world, India has been making progress. And in addition, Niti Aayog also comes out with a calculation which is also looked at by the UN of the multidimensional poverty index. And in the last 10 years, something like 25 crores, 250 million people have escaped from poverty through a combination of various initiatives, yes, of the government, but not the union government alone, but of Team India. So there is a lot to celebrate. But the Prime Minister, who is always urging the country to look ahead, has, as you all know, put before the country the aspiration, the vision, the challenge of being a Viksit Bharat by 2047. And what does Viksit Bharat mean? It means not just being a large economy, but being a modern economy, but also one that, as with other advanced countries, is one which is able to ensure a decent standard of living to all its citizens. And so that is the larger framework of why being here and being at this event is of particular importance to me, because one of the roles of Niti Aayog is to share best practice, and indeed to make sure that best practice at the level of the states can then become common practice across the states.
For Doctors for You to stand here and being a part of this historic movement that is happening. I have always believed in a philosophy is the best way to find yourself is to lose yourself in the service of others. And this is the philosophy with which the Doctors for You was started in the year 2008. But I can say with a lot of pride that Doctors for You is working across almost all states of India and implementing CSR projects of at least 100 of these CSR partners. But the way that the CSR projects have been implemented in Nagaland in the last 2 years have been completely different. The kind of support that is being given from the government, the kind of support that is being given from IDAN, the kind of transparencies that have been created in the systems are completely exceptional. And though I'm very, very sure that there is a big team behind it, but one person because of which I think this is happening is Shri Rennie Wilfred, who supervise, who personally get involved in each and every aspect of it. Since we're talking about this histopathology lab, I'll just give you a brief example of this. So most of the time the CSR project happens is that there is a need of some equipments. A CSR partner come forward that yes, this is an area that has been implemented. Some equipments are bought and being placed into that particular place. However, Mr. Wilfred and the team was involved that what equipments are to be bought, what are the quality measurements of that, then they are being placed into the system, then the site was checked, what are the areas where the cabins were to be made. When the cabins were created, due to some miscoordination, the wooden racks were being created. It was rechecked that why the wooden racks were recreated. They were dismantled. The aluminium racks were recreated again on that, so that each and every aspect of being taken care of. I can say this, that we have never experienced such kind of monitoring of the system ever. So we are extremely fortunate to work in Nagaland on various projects. As Mr. Wilfred has mentioned, our first experience of a CSR project with the state of Nagaland was the dialysis center, and for us also, we have implemented I think 7 or 8 dialysis center across India in various states, but still we consider our Dimapur dialysis center as the modern dialysis center that we have created. Apart from this, we have built up with the support of IDAN and BPCL the upgradation of the nursing college also, and which probably you will be seeing it soon. Another effort that we are trying is setting up a CT scan at this hospital. Another important project that which we have recently started is access to care. The incidence of non-communicable diseases is increasing a lot. There has been a big stress of Union Health Department also to focus on early screening, because what happens is that we pick up the diseases at a stage when they have already crossed a boundary and they have reached to a partially reversible or sometimes non-reversible stages.